Hello, I'm Dr. Franck Yata. We've completed the basic course on erectile dysfunction. We'll now present topics based on your requests. So, feel free to suggest topics related to our main theme. Since our channel is in its very early stages, I suggest you subscribe, like and share so that many can benefit from it.
So, today we will try to answer the question, how does stress cause erectile dysfunction?
Many people believe that psychological factors like stress and anxiety are responsible for erectile dysfunction. Well, yes, this is indeed true, and according to recent studies, it's true in over 80% of cases. Some people may wonder what stress, anxiety, and even depression really are. In fact, in the context of erectile dysfunction, they are the same thing in the sense that they produce the same consequences. To make it easy for everyone to understand, we'll define them as follows. Stress is a mental state in which the level of brain arousal is very high, leading to intense mental agitation. Its physical manifestation is often fatigue and decreased concentration. Almost always, stress arises from a difficult situation in the patient's real-life environment. There is a cause and effect relationship when faced with a major problem. Anxiety is a mental state of fear and excessive worry about a situation that has not yet occurred, but is likely to occur. In fact, the anxious person is mentally blocked. Their brain functions are severely disrupted by fear of a possible negative outcome. There is no cause and effect relationship. Depression is a mental state where the depressed person has lost all interest and is even suicidal off what is happening because of several unfortunate events that have happened to him or that he is afraid might happen. The person is sad, desperate, and tends to give up on everything. In this case, too, there is a blockage or profound alteration of the humoral functioning of the brain. In all three cases, the brain appears to be overworked and in stress management mode, meaning that it is almost continuously activating its sympathetic neural system. This is not the parasympathetic system, which is known for its relaxation and calm, in which the brain carries out the process of sexual erection. If you want to know more about the difference between the sympathetic and parasympathetic nervous system, we'll cover that in another show. In summary and in fact, stress, anxiety, and depression will exert a negative cerebral influence on sexual arousal, which will cause an alteration of desire, hence the reduction of erection, or even impossibility.
So, doctor, what do you say when there are no underlying diseases, but ED is present?
How do you know if your erectile dysfunction is psychological or organic? Organic means there is another previous or coexisting disease or condition causing the dysfunction. Well, when you have erections while sleeping or masturbating and no underlying conditions, the main factor involved is usually psychological. And it's almost always stress, anxiety, or depression. In this case, it's not an organic problem.
What is the actual brain's action to create erection?
One thing to remember is that the erection process begins with perception, meaning the brain must be able to properly use its five senses: sight, touch, smell, hearing, and taste. There is also talk of a sixth sense, if you want to call it that, which is thought or memory. Unless it is during sleep, where the process is a little more complicated, the brain almost always uses these first five senses of perception to induce erection. So the brain must have collected and processed enough information through sight, touch, smell, etc. to be able to send the order to the penis through neurotransmitters and hormones to initiate the erection process. These are notably testosterone and dopamine. To do this, the brain needs to operate in a relaxed mode to produce a good ejaculation. Because in reality, the purpose of an erection is ejaculation. Ejaculation is, in fact, the body's natural process par excellence for regulating stress. Indeed, sexual activity and ejaculation provide benefits including positive effects on the heart, brain, immune system, sleep and mood, prostate, etc. So the brain achieves this through its parasympathetic nervous system. Now, the parasympathetic system directly opposes the sympathetic system. When one is excited, the other is inhibited, and vice versa. The proper functioning of the entire organism lies in the balance of their actions. We will discuss this in detail in another program. Thank you for following us. Please continue to the next episode to see what happens next. In the meantime, remember that the intimate act has a framework. That's the marriage.